What most people don't know is that uterine cancer is the fourth most common cancer in women, and over 40,000 women each year are diagnosed with uterine cancer.
Sharon Winkleman was one of those women.
I had a very slight symptom. It wasn't even like bleeding. I mean, it was just a little tiny bit of spotting here and there. I thought, well, that's unusual.
Sharon mentioned her symptoms to a family doctor during an annual physical, and diagnostic tests were performed.
Everything looked fine, except the pathologist report. There was no big tumor or anything. We got it very, very early, but the pathologist report came back that it was cancer. So he said, you need to go to MD Anderson.
If caught early, like in Sharon's case, uterine cancer is highly curable.
There are obvious signs and symptoms, and those include if you're postmenopausal, so if you've gone through menopause already, any bleeding is considered abnormal. And if you have not gone through menopause, if you have irregular bleeding, so heavier than normal or bleeding between your periods, that's considered abnormal and should be followed up by your physician.
As with most types of cancers, there are increased risk factors to be aware of.
Women who are obese have a 2 to 4-fold increased risk. And that of all cancers related to obesity, endometrial or uterine cancer has the strongest association.
Dr. Karen Liu and her colleagues at MD Anderson are conducting research and clinical trials for diagnosing and treating uterine cancer.
Despite the fact that this is such a common cancer, there hasn't been a lot of research and focus on this cancer. And MD Anderson is the only hospital, the only institution that holds a very important grant from the National Cancer Institute to bring together physicians and scientists to focus on the disease. And that's something that we're very proud of.
MD Anderson is working hard to help women recover quicker and live well after cancer.
One of the most novel things that we're doing at MD Anderson now is minimally invasive surgery. Rather than making big incisions to remove the uterus and the ovaries and perform staging procedures, we are now really moving towards minimally invasive surgery, which uses smaller incisions and gets women back on their feet and back to home in a very short amount of time, and the recovery is significantly shorter.
The surgery was in September, and I was through with the radiation treatments about Thanksgiving. And then I went back to work. I mean, I was fine.
In addition to fighting the cancer, MD Anderson also focuses on caring for patients emotionally and psychologically.
There is a volunteer network here. There's all kinds of online things that you can go to. There's the MD Anderson network that you can go to. The more I talked about it, the more normal it got. I mean, it wasn't like so scary anymore all of a sudden. Because right at first it was very scary. It was very scary.
We've really focused on life after cancer and developing support groups for women with uterine cancer to talk to other women who've gone through similar treatments.
Sharon Winkleman's advice to women is, listen to your body.
As women, a lot of times we have other people to take care of. We have children, grandchildren, husbands, families. We try to take care of everybody else first, and we talk ourselves out of saying, oh, well, it's nothing, and we just ignore it. If it's bothering you, and if don't ignore it, even little something, because it's way better to get taken care of early than to wait until it's later, and then it's not so easy to take care of.
Thanks to her own self-awareness and MD Anderson, Sharon Winkleman is now a happy and healthy cancer survivor.
There wasn't any other place for me, and I know there are a lot of other places, but you always know you're going to get the most up-to-date, the best expert treatment at MD Anderson, so that's just where I came. It worked out great.